When our clinicians stop having to chase IT, their entire perception of support changes for the positive, moving to a feeling of seamlessness and to a feeling of support. And that's exactly the direction that we want to see things heading in.
So traditional metrics do still matter, but experience metrics just matter more to the clinician. Measure what matters to the user. If your metrics don't reflect how support feels, you're optimizing the wrong thing.
Please, 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 please stop designing IT support around systems. Let's shift the focus. Let's start designing it for clinicians.
HTC TechWave.
Welcome to the HTC TechWave Podcast, where we explore technology and innovation and how it shapes the future. I'm your host, Kisha Parnell, Director of Performance Excellence at HTC. Today, we're talking about AI and its impact on the user experience in healthcare operations. Whether you're a CIO, an IT director, a clinician, or if you're just curious about why some of the best technology investments don't always translate into happier clinicians and staff, well, you're in the right place. In today's episode, we'll explore the user experience and how it's improving satisfaction for clinicians and staff in healthcare operations. We'll discuss why traditional service desk models don't always seem to succeed in clinical environments. We'll also look at what a true user experience first model looks like. And then we'll discuss how AI and smart process designs are quietly transforming the support experience from reactive to a more proactive model. To explore this with us today, we have two industry leaders who will share their insights. Joining me is Brett Larson, Director of Operations in our BPS practice for healthcare. Brett brings extensive experience supporting service desk transformations and operational excellence across complex healthcare environments. Welcome, Brett. And we also have Natalie Giventhal bringing her perspective on the user experience first model as a client relationship representative for the BPS practice in healthcare. Brett and Natalie, welcome to the HTC TechWave Podcast.
Very happy to be here.
Thanks, Kisha. Looking forward to our conversation today.
Excellent. Brett and Natalie, I'd like to start today's conversation with understanding the big picture around the user experience and how it's impacting healthcare operations. As you know, hospitals are investing in more technology even faster now than ever. However, it does seem like clinician satisfaction with these technology advancements don't always equate to happier clinicians. Why do you think the user experience for clinicians has become a critical priority right now? And where do you think traditional support is breaking down? Natalie, I'd like to open today's conversation with you.
I love that question, Kisha, because I don't think it gets talked about enough. Here's the reality. So many clinicians are just overwhelmed, right? So if you look at their typical day, their schedules, it's packed from start to finish with things like patient care, documentation, following compliance rules and regulations, administrative responsibilities, tons of other demands. And now these systems, they're adding just a growing list of digital tools that they're expected to use. And then they're not just having to use them, but they're expected to use them effortlessly, right? So we already know that each and every day, everything that they're doing, it just matters, no matter what it is that they're doing, right? So when their systems are slow, and then their logins are failing, and then technical support is almost impossible to reach, all of these things, they feel huge in that moment. And that kind of distraction, which, by the way, can sometimes be every single day, it adds up. It doesn't just create a distraction, but it frustrates clinicians and it contributes to occupational burnout. You start to see this domino effect into negative morale. You start to see some poor productivity. You also start to see, unfortunately, some reduced retention rates, right? So ultimately, all of that frustration, it starts to carry over into patient care. It's not at all what we're looking for, right? So here's the interesting fact, right? Not a lot of people think about this, but healthcare organizations, they're investing so much more in advanced technology than they ever have before. But even with these major technology investments, all of these clinicians, they're feeling way less supported. It's the complete opposite of the overall goal.
Yeah, and a big reason for that gap is that traditional service desks have been built around IT efficiency rather than on what clinical reality. This mismatch shows up in what each side actually measures. Service desks like to focus on things like getting tickets created or achieving SLAs by picking up the calls quickly, and call handling time to, again, get onto that next call quickly. Whereas clinicians care more about some different things, such as how fast they can get back to their patients and whether the support person actually understands urgency in the way that they do. And do the same issues keep repeating over and over again? Because we all know how frustrating that can be.
Yeah, I'm just to kind of add to what Brett just said, when a ticket is closed on time, that doesn't necessarily equal somebody having a good experience, right? That's what we think, but it's just not how it works. But even with that being said, the industry, I'm seeing it starting to evolve. It's starting to change and reframe all of it, right? So we're seeing things move and shift from that traditional IT support system to more of an experience-based enablement model, right? Because at the end of the day, we don't measure success just by getting the issue resolved, right? It's more about how is the clinician feeling while their issue is being handled, how much they had to navigate along the way.
You both make some really great points. And the distinction between delivering a great experience and the need to meet an SLA is quite interesting. So Natalie, I'd like to explore the user experience a little bit more. If we see that the traditional support model is falling short, what does a user experience first model or approach look like in a healthcare service desk?
I'm really glad we're touching on this. I do fully believe that it starts with extremely intentional design, right? So an experienced first approach means three things in particular. First, I would say prioritizing based on clinical impact, not just the severity codes, which I think a lot of people are used to. Second, I think it should be designing around clinical workflows instead of those IT silos that we're seeing happening so frequently, so that the system is actually fitting how the clinicians are working day to day. And then third, I would say reducing user effort at every possible step. And what that looks like, what does that mean? It looks like fewer clicks. It looks like fewer handoffs. It's going to be fewer ticket forms to fill out just to get help. So the real goal here is to make support feel like it's almost invisible, right? We want to make sure that their issues are either being resolved quickly or, quite honestly, prevented altogether.
Thanks, Natalie. So it sounds like you're saying that the user experience first model delivers a faster, more seamless approach. And that approach sounds quite amazing. But I want to turn this conversation over to Brett. Brett, can you tell us what the user experience first approach looks like for a clinician in practice?
Absolutely, Kisha. Instead of forcing a clinician to log a ticket, modern environments offer some different innovative features like one-click support from within the clinical applications, where they can directly get help from the level 2 experts if that's what's going to be required anyway. Or contact the where request that auto fill in details. So no typing out of the problem is required, or even a dictation type system, which doctors are quite familiar with. And then immediate resolution for common issues. No waiting in a queue, which again gets back to shortening the time it takes for them to get back to providing the potentially life-saving procedures that make up the truly important parts of their day. All of that dramatically improves on clinician satisfaction.
I agree, and I absolutely love that approach, Brett. Making that support invisible and easier for the clinician seems like the way to go. But Natalie, that brings us to the topic of AI. There's a lot of chatter in the industry about how AI is, moving through and making processes more efficient. So because of a lot of what Brett just described, that context awareness, instant resolution, fewer steps is where that AI is making the biggest impact. But how would you say AI is improving the clinician and staff experience?
Believe it or not, I get asked this question a lot. And what I can say is that AI helps in a few practical ways, right? So for example, instant resolution, right? What does that mean? AI-powered virtual assistants can handle common issues like password resets. It can handle issues like access requests. It can handle device problems right away. And it does it, no wait time, no ticket queue, just really instant resolution. Another example is smarter prioritization. A lot of people ask, what does that mean? We hear it here and there. Well, smarter prioritization means that AI has the ability to recognize when something is actually impacting patient care. It automatically fast tracks it. The clinician doesn't have to stop. They don't have to explain to somebody why it's urgent, right? And then lastly, AI is making an impact through proactive support. So broken down, AI can quickly analyze patterns. It spots issues really early on. It alerts IT before the issue spreads. And here's the cool part, sometimes before the clinician even realizes that there's a problem.
Nice. So AI is helping to move the focus from more reactive to proactive while delivering some real-time analytics. This sounds like a great model.
It's so true, Kisha. When our clinicians stop having to chase IT, their entire perception of support changes for the positive, right? So we're seeing this shift from a feeling of being reactive and feeling super frustrated, and it's moving in the direction that we want to see it move into. It's moving to a feeling of seamlessness and to a feeling of support. And that's exactly the direction that we want to see things heading in.
I agree. And that change in perception is exactly what makes this transformation real. But Brett, I want to turn this conversation back over to you because it raises a very critical question for any leader trying to make this shift. Once an organization moves to a user experience first model, how should they measure whether or not it's working?
So traditional metrics do still matter, but experience metrics just matter more to the clinician. Some of the ones leading organizations are tracking now include clinician satisfaction scores, which is a subset of the overall customer satisfaction, effort to resolution, or how hard the user had to work to get the help they needed, repeat issue rate. So is the same problem coming back over and over? And I mentioned earlier about how that can be a hot button. And then agent empathy and communication quality, which we can accomplish through AI-assisted call reviews, such as we do here at HTC with our Themis QA tool. These metrics tell you how support actually feels, not merely how fast it got started.
Excellent. Those are some really great points, Brett. And I believe they are truly the metrics that move the conversation from that output to outcome. But before we close today's session, I'd like for each of you to provide one final thought. And Brett, I would like to start with you. From an operations standpoint, what is a key takeaway that you would like to leave healthcare leaders with?
So for me, I have to quickly mention a few crucial things. Number one, treat every support interaction as a clinical moment, because for the clinician on the other end, it usually is. Number two, invest in your people, not just your platforms. Empathy and healthcare contact cannot be automated. Number three, measure what matters to the user. If your metrics don't reflect how support feel, you're optimizing the wrong thing. But get these things right, and I do think the technology investments will start paying off.
Beautifully said, Brett. So Natalie, if you had to leave healthcare leaders with one thought or mindset shift to take away from today's conversation, what would it be?
I can say without a doubt that it would be please stop designing IT support around systems. Let's shift the focus. Let's start designing it for clinicians, because what we're seeing is that when clinicians feel truly supported, the positive effects extend across so many outcomes, so much efficiency, and the overall care experience.
All right, that brings us to the close of today's episode of HTC TechWave with Brett Larson and Natalie Giventhal, leaders in our BPS practice in healthcare. Thank you, Brett and Natalie, for joining us on the podcast to share your insights on how a user experience first approach, powered by AI, empathy, and a smart process design, and how it's truly reshaping the way clinicians and staff experience technology, and in turn, how they deliver care. In the next episode, we'll share more innovative conversations about how technology is shaping the future of healthcare. And thank you to our listeners for joining us. From all of us at HTC TechWave, this is Kisha signing off.